we are here to talk about Aduna project. When it comes to e-motive bundle or the module, it's a module where there is prevention as well as treatment of postpartum hemorrhage. This e-motive module or the bundle has P, that is prevention of postpartum hemorrhage, as the first step. When it comes to e-motive module, it includes earlier detection of postpartum hemorrhage. And we know that it's a dreadful complication which can actually be fatal for the mother. So that's early detection, that is the first step, followed by uterine massage. And the module focuses on that particular component, on how much and how many times and how frequently that massage needs to be given. Followed by oxytocic drugs. All the indications, the first line, the second line and the third line, and alternatives in form of various drugs and their side effects, maximum dosage, and how many times we can or we should or we are to repeat those particular medications. Followed by a recent inclusion of tranexamic acid as a treatment or therapeutic agent for postpartum hemorrhage. Then it will be followed by IV fluids. So these are the components of e-motive module.
We need to practice active management of third stage of labor in every case of delivery. So here, after the delivery, we are going to give carbetocin, which is an oxytocic, heat-stable oxytocin, 1 milligram that contains 100 milligram of 1 ml, which contains 100 milligram of carbetocin. Then we look for the signs of separation of placenta, do a controlled contraction to remove the placenta, and then we massage the uterus if needed.
So here, how to measure and to know how much the patient has bled. So we have a drape here which is for early detection and the alert line. This is made by Foxy and it's very comfortable for the patient to use it. So the patient can lie down on this, and after the delivery has taken place, amount of bleeding which is collected here can be seen. If you can carefully see here, we have an action line and we have an alert line. So when to begin the work which has to be done for the patient is shown here, and it's very simple, and this will help you to know when is the time that you have to take action.
Absolutely. And as soon as we cross that action line, the first line of treatment is generally a uterine massage. So what you'd want to do is insert 2 fingers into the vagina and abdominally massage the fundus to ensure that the uterine contraction takes place. That obliterates the sinuses and that ensures that the bleeding is less. You should continue the uterine massage to ensure that the bleeding stops, and in case it doesn't, then further action would need to be taken.
In the rare event that these physical measures do not work, your next line of action should be medications. The 2 medications that we would consider as a first line would be oxytocin and misoprostol. Oxytocin, 20 units should be started as a basic dose apart from what you have given as a part of your active management, and it can be increased to as high as 180 units as well. The other drug which is extremely useful in managing postpartum hemorrhage is your misoprostol. Misoprostol can be used either parectally, orally, or sometimes even inside the uterine cavity in case if you are doing a cesarean section, from a dose ranging between 600 micrograms to 800 micrograms.
In case these measures fail, we can also go for another molecule. Enough evidence is there to support the use of tranexamic acid, and a dose up to a maximum of 4 grams can be given.
IV fluid, we have to access 2 IV line with the 2 wide bore cannulas. Early you are giving the fluid, you will be saving the patient's life. The faster you are giving the IV fluids, you can save the patient's life when the patient is going in the shock.
When all these measures fail and the patient is still bleeding, first of all we need to empty the uterus, and then we should examine the patient and look for any retained product of conceptus. If present, we have to evacuate the uterus, and if the atonic PPH still continues, we need to put an intrauterine balloon tamponade, and still if it doesn't work, we may have to go for conservative surgical procedures, and as a last resort, hysterectomy.